Hi, I'm Dr. Gerald Deas. Welcome to Health Center from Downstate Medical Center. You know, there's a song that comes along with summertime. My voice is not that great, but summertime, when the living is easy, fish are jumping and the cotton is high. Now, I know you're not planting any cotton and the cotton is not high, but that's an old song that summertime living is easy. But living is easy has a lot to do with your health, because if you're not healthy, you can't live easy, you know. And so therefore, what happens during the summertime? What takes place with our bodies in summertime? It's different than wearing a coat, winter hat and things like that. Now you're dressing down and the sun is out and maybe too much sun, and which can affect even cataracts of the eyes and things like this if you have to sit out in the sun too much. But you need sun for vitamin D, because if you don't have sun, vitamin D is not activated. You need active vitamin D3 to take if you're not in the sun. And so therefore, we're going to talk about the sunny days and what takes place with children as well as adults. And here we have today from the family practice, our prestigious director of family practice here, Miriam Vincent.
Good morning, Dr. Vincent.
Miriam Vincent, it's good to see you. And we also have one of our doctors.
Yes, this is our faculty development fellow and geriatrics fellow, and he's been working here now for about 8 years, okay. Dr. Edward Allen, who came from our medical school.
Oh, that's wonderful. Now, Miriam, I know you have interest in so many subjects, and being head of a family practice and taking care of people. I know people is your basic movement. I mean, that's just your passion is patients and how they care for themselves. But let's talk about patients in the heat. When the heat starts rising, the sun is shining, and and everything is happening.
Well, in summertime, the living is easy. People have a lot of vacations, but also people have challenges, and you want to keep the living easy, and you have to realize that that sun brings ultraviolet radiation, and everybody, light-skinned people, dark-skinned people, have to be able to protect their skin and their eyes.
Surely.
So one of the things that you want to do is make sure that you're wearing clothing, that it's light, cotton if possible, that allows you to sweat, because the body is very smart, and if that sweat evaporates, it'll help keep you cool, like the radiator in your car.
Of course.
So that's the first thing, is you have to be able to sweat, and you have to be able to cool yourself. So you want to make sure that if you don't cover your body with clothing, light clothing that will absorb the perspiration and allow it to evaporate and help cool you, that you're also covering and wearing some suntan lotion that will help protect you.
Surely, yes. And you know, and suntan lotion has its disadvantages and advantages also, you know, because if you don't get enough sun sometime coming into your skin, that suntan, that solution can prevent certain things happening in your body, you know. But even we talk about elderly people with sitting too much in the sun without protective eyes, the glasses and things like that.
Well, not all sunglasses are the same. You have to make sure that when you purchase, and you can buy the sunglasses in the drugstore that aren't so much money, or Costco, or in one of the larger department stores that have specials, like, you know, the Targets and the Kmart, as long as they filter that ultraviolet radiation, because that can cause changes in the lens of your eye. That's very true. And you don't want that ultraviolet radiation damaging the retina. So that's important to know. But the other thing about the sun and the heat, as you evaporate, you're losing fluids.
Yes, surely.
This is a problem. It's a problem in the very young patients where they have a large surface area compared to their volume, so they dehydrate easily, as well as in very old patients. And that's why we have our expert in geriatric medicine here in the Department of Family Medicine to come and talk to us about other special needs in the elderly patients, such as fluids. So one thing we say in general is, and you and I have talked about this for years, is forget about the sodas, forget about those sugared sports drinks. All they're going to do is make you fat and make your insulin not work.
And sweat too.
And, well, you need some fluid to make you sweat during the summer, but that fluid could be water with a little bit of fresh fruit in it, lemons, limes, oranges. Just cut up, clean off the outside, cut it up a bit, whatever you like, lemon, orange, lime. You know, you can use a quarter of it a day. and squeeze it into that water and have it in the refrigerator so it's nice and cool for you.
Now, what about the waters that have the sodium and potassium electrolytes in it, like the Gatorades and things like this?
Well, the problem there is if your kidneys are bad, they're not so good for you. If you have a problem with your heart, they're not so good for you. If you have a good balanced diet, and we'll talk about nutrition in the summer, because a lot of times, especially elderly folks, but everybody, we're not as hungry when it's so hot. But it's important to get that good nutrition. So if you ate your broccoli and your greens, and you ate your potatoes and your rice, and you ate your chicken and your lean beef or lean pork, you don't need those electrolytes, because everything you just ate has the vitamins and minerals in it. Right. And it's always better to get it from a natural source. So a lot of times those sports drinks, they're high in calorie and they're not giving you what you should need. You shouldn't replace good nutrition with a high calorie, not so nutritious sports drink. The water with the fruit and a good meal. Now, a good meal doesn't mean that it's a plate you got to hold up this big with two hands.
Right.
The portions that people should be eating, winter or summer, are the size of your palms, not your fingers, just your palm, and that. So people from the Caribbean say, "Doc, come on, this is how much rice you want me to eat? Are you joking?"
How about my big hand?
Well, you're a big guy, so no fingers, Dr. Deas. Just this, right there. That's it. I'm gonna tell your wife. So that's the deal. But the good news is that when it comes to the greens and the broccoli and that. You can eat as much as you want, but watch what you put on them. You don't need butter and all that salt. They taste good in and of themselves. So we have Dr. Allen here, because Dr. Allen, this is a real tough question that older people want to know.
Looking forward.
And we're telling people drink a lot of fluid because you're going to sweat. But sometimes people have trouble with their heart and with their kidneys, and they're saying, here I have my doctor in the office saying, watch how much fluid you take in. And yet, I have a three doctors on TV now saying, drink fluids during the summer. And the patients are confused, who's right?
Well,
who's wrong?
maybe Dr.
So
Allen.
he's going to let us know. So the question is, I just told folks out there, drink a lot of fluid. How do they know when they have enough fluid? And then how are they going to tell when they have too much and too little?
Okay, well, it is a balancing act. You're not wrong, their doctor is not wrong. It's a balancing act of two opposing forces. How do you know when you've had enough fluid? Well, some of the things you could use to tell you that you've had enough fluid is taking your weight. Daily weights become important for the person with heart failure. A weight gain of about 3 pounds or more in a single day becomes problematic for a heart failure patient.
Because the heart's not going to be able to pump, and then that fluid ends up in the lung. Next thing you know, the patient's in the emergency room.
Correct.
So the patient knows they're in trouble if they have heart failure, if they start becoming short of breath. That's helpful.
Correct.
How else can they tell by looking and gauging how their body behaves?
They could also tell by looking for swelling in the legs. That's another sign that you might be taking in a bit too much fluid.
Well, how do they know if they have too little fluid? Can they tell by looking at the saliva in their mouth?
Yes, that's actually a very good way to tell. Sometimes our mouth may feel dry, but if we find that we're not making enough saliva, enough spit, that could be a sign that we're not taking in enough water on a daily basis.
Right. And another thing, Dr. Allen, we often, when the patient comes in out of the sun and they're sweating a lot and they're really going out of it, just tinting the skin.
Sure.
Just bringing up the skin. If that skin doesn't go right down and it tints up there,
Correct.
you might be dehydrated.
You might be dehydrated.
And so you can even do that at home.
Yes.
So all they have to do is
That's
pull on the
easy.
top of
That's
the
right.
skin, they
Pull
let
the
it go, and
That's
it goes flat, they're okay.
That's right.
If it stays like that,
That's
the
right.
tissues don't have enough fluid.
Yeah.
Correct.
How about
Correct.
the amount of urine they're putting? Nobody ever wants to talk about urine.
That's
Is
right.
urine important?
Urine is very important.
Right.
Not just the amount of urine. If you see a decrease in the amount of urine you're putting out in the hot summer months, it may be an indication that you're not taking in enough fluid. But also look at the color of the urine.
Yes, that's so.
If the urine becomes darker than usual, that may be another indication that you need to be consuming some more
Using the
fluid.
kidneys here.
More fluid. You
Right,
can't.
yes.
And how about when people feel thirsty? I'm sitting here with a cup of water, and I'm thirsty, and I don't care we're on TV, I'm going to drink my water. Is that a good thing?
Well, it is a good thing. Thirst is one of the body's ways of telling us that hey, you need some more fluid. We're becoming a little bit behind on our fluid balance. We're becoming dehydrated.
That's the hypothalamus in the brain.
That's the brain telling
That's
us
right.
that the rest of the body is feeling kind of dry. You need to take some fluid in.
Now tell me this, like I made house calls during my practice, of course.
He makes
and-
house calls too, and so do I.
Well, there we go. That's family practice.
That's
Yes,
right.
yes.
Which is very important. But the thing is, you go into a home and you see the person laying out there. What would be the first thing you would try to do if that person was unresponsive and they're dry and so forth? Should you call an ambulance immediately to have that person looked at, or do you try to treat it at home?
Well, if that person is not responding, I would call an ambulance. That is an emergency.
They're in
Right.
trouble. If the
They're in
family
trouble.
finds a patient
Right.
and they're not talking, and they usually are talking to
Right.
them, and they're laying out there and not responding, you can't give them something to drink because
Right.
they're going to choke and
Of
that
course.
fluid will go into their lungs.
Of course. And you know, a lot of times the elderly people have a tendency to close their windows.
Yes.
instead
Well,
of
that's what we
keeping their
look
windows.
at.
You
We
know,
need windows and a fan.
a fan, that's
If
right.
you can,
At
an
the
air
very least,
conditioner.
yes.
Yeah.
But not everybody can afford
Put
either
in-
the electricity or the air conditioner.
That's
And
right.
sometimes the wiring. You know, we're dealing with old houses in
Houses,
Brooklyn,
surely.
and the wiring can't take an air
Surely,
conditioner.
surely.
But a fan,
Yes.
an open window. You gotta be careful on the first floor in Brooklyn. You know, you gotta get window guards because somebody will be crawling in your window.
Well, the thing is that, the other thing is that I think that family practice maybe should even encourage elderly people to give them a fan when they come in to see you in the summertime. To give them a fan with family practice written on it. So with little things
You gonna
on
help us
it.
get the funding for that?
I
Dr.
can
Deas?
get the funding for it.
That's
yes.
an idea.
We'll give out fans.
That's an idea.
My husband takes a fan with him when he goes to work.
That's right. Well,
And
people
has
have
a little thing that squirts water.
Well, not only that, but how about the people in church? They're always fanning.
Oh, they're always fanning.
because the air conditioning in churches. They go to these little storefront churches.
Yeah.
They have no adequate air conditioning. Those people are sweating in those little churches, and then they get excited, which adds more.
And then they took their anti-diabetic medication
Yeah.
and didn't have time to eat breakfast. So you know they're going to be passing
That's
out.
right, you
Yes,
know.
yes.
And so therefore, maybe just because we have very short time to finish, what's the last thing you would tell a patient as you see them in the summertime to prevent all of this when they come in to see you just on a regular basis?
Well, make sure you're taking your medications if you are on medications. That's the first thing. If you notice any changes in your body, such as dizziness
Right.
on a regular basis, then you should see your doctor right away for that. That may be an indication of something serious happening.
Right.
Make sure you consume enough, drink enough water, enough fluid.
Right.
Keep your living environment cool.
Okay.
Open the window, use a fan. If you have air conditioning, that is better.
And stay away from the liquor store because that alcohol will dry you out. It makes you
Right.
urinate and takes the fluid out of your body.
Well, I'll tell you, Dr. Vincent and Dr. Allen, I think they have enough to know that looking dehydrated or tending to the skin and things like this, dizziness and things like this, that they should be calling a relative or a neighbor
Yes,
to check
yes,
on
yes,
them.
yes.
Buddy system.
Buddy
Always have a
system.
buddy system with your
Right.
neighbors.
Right.
Share your food.
That's right.
Share checking on each
Right.
other. Don't share your medicines.
Right. And your summertime will be easy.
Dr. Allen, thanks so much for coming today, for sharing your expertise regarding elderly patients and how they can best prepare themselves for the summertime to make and keep life easy for them. And thank you for taking such great care of our patients, our elderly patients, especially in the community.
My pleasure for being here. Thank you for having me. Thank
Great.
you, Dr. Deas.
Dr. Deas,
Yes.
guess what? I have a surprise for you today.
Okay.
We have another fellow here.
Do
We
tell.
Yes, we have our family medicine, faculty development, women's health fellow.
Oh, that's wonderful.
So Dr. Grover has been working in family medicine, but also with the women in our community, pregnant women, women with concerns related to women's health, the special issues that women have. So welcome, Dr. Grover.
Thank
Great
you.
to have you.
Thank you. Great
Well,
to be here.
I would say it's not over until we speak to Dr. Grover.
Right.
Okay. So what do you think are the special issues that for example, pregnant women and all women have with regard to hydration, with regard to the sun? And what about women exercising during these hot summer months? What can you tell us?
No, those are all very important issues to discuss, particularly with pregnant women. You know, they have so much going on in their bodies that sometimes they may see things that they wouldn't normally see if they weren't pregnant, such as swelling of their ankles and of their feet. And, you know, it's very important to keep in mind that these types of changes can happen weather-related, but it can also happen, you know, due to maybe high blood pressure, and that's very important for them to just be aware of. And they should try to take as much rest as they can during the summertime, not to overexert themselves. Stay indoors as much as they can.
During especially the hot times of the
Correct.
day. So if they want to go out and get a little exercise, it's better early in the morning or later in the evening at dusk kind of thing.
Right.
But pregnant women have their hands and feet swell anyway. I remember when I was pregnant, I couldn't get my rings on. And during the summer, you tend to swell. So how do they know when the swelling is too much? Does it happen too fast? What would be the signs?
If it's something that happens more quickly, then most likely it is climate related. If it's starting to happen slowly, and you know, I think they should definitely go see their obstetrician.
How about if they get a headache with it?
If they get a headache, if they have any types of blurry vision, if maybe they're not urinating as well, if they feel that their blood pressure is rising. These are all symptoms and signs of a much more serious condition, possibly preeclampsia. And
Related to pregnancy?
correct. And
Wow.
this-
So pregnant women have special health concerns during the summer. And if any of this happens, they're going to go right away to an emergency room if they can't get to their doctor immediately.
correct.
And Dr. Grover, it's very important, you know, in areas where there's a lot of stores on each corner, and people are depressed anyhow, they look for comfort foods.
Right.
You know, and the comfort foods are lined up in these little stores.
Right.
Everything
Right at
from
the
salty-
register, where they're easy to get, right?
Right, sure. Easy chips, easy cookies, easy.
And they're cheap.
And they're cheap.
Right.
And so it's easy to pull a bag off for 50 cents, you know, that's loaded with salt, potato
Right.
chips, and all those things. How do you try to advise them against this kind of diet?
Well, when you have increased salt content, that's just going to contribute more towards the swelling, more towards possibly raising up your blood pressure if you're already at risk.
Right.
So I would really advise particularly the pregnant women to concentrate on much more of a healthy diet, as well as non-pregnant women.
Right.
So fruits,
Fruits and-
vegetables.
Right. Fruits and vegetables are very good, especially in the summertime, to even keep you hydrated. If you
Juicy, right?
Right.
The juicy
They're
is water.
juicy, they make you feel better, and there's such good health benefits with some of them. I mean, at the end of the day, most women want to still be in shape, you know, especially during the summertime when it's time to get beach ready.
Right,
So they
sure.
should concentrate on certain types of foods that are going to help them. Blueberries have anthocyanins on it. That helps to prevent against muscle fatigue. But, you know, as Dr. Vincent said earlier, be careful with the portion size of your blueberries.
Well, you know, like there's always in the supermarkets this time of the year you see beautiful watermelon. You know,
Oh,
that's
man.
you know, and that's
Juicy.
juicy and water and so forth. And,
Right.
you know,
Relatively inexpensive.
that's relatively inexpensive. So some of these things are.
Right, and it's very good. Although with certain types of fruits, if a pregnant woman has a diagnosis of gestational diabetes, I would say, you know, just consult with your doctor first as to the types of fruits that you should eat.
And how much?
And how
Types
much.
and how much.
Because they
Yes.
can be sugar loaded, as healthy as they are for you. Then you should maybe stay away from certain types of fruits versus others. But overall, try to stay away from the salty chips.
Right.
Try to stay away from other types of you know, the gross, just right by the register types of foods and everything, and try to reach for more of the healthy options.
Now,
you
when
know
a
what?
patient had some time on, say, water pills, diuretics, now, taking a diuretic can be a problem during the summertime. Not only during the summer, just in general, because you're losing not only your potassium, but your
Correct.
magnesium. And magnesium, that's almost a thing to prevent that pregnancy going bad,
Right. It
or
is
low magnesium.
Right. It is very important, first of all, for pregnant patients to continue taking their prenatal vitamins because they can lose certain electrolytes, such as the magnesium, such as even folate.
Yes,
so
surely.
it's very important, for the integrity of their pregnancy to maintain these key vitamins. But in terms of diuretics, be careful because you
Yes.
don't want to lose water. You don't want to lose healthy fluids that help maintain your blood pressure at the same time.
Right, surely.
Once again, consult with your doctor.
Right.
Well, the other issue is that women have to think about, particularly when they're pregnant, they're not only feeding themselves, they're feeding their baby.
Baby, sure.
So they can't lose the folic acid. That it's not only them anymore. And I think when pregnant moms know about this, they really want healthy babies.
They do.
Yeah, and not only that, but you can't take folate when you're 3 months into pregnancy. We got to think of folate before,
Right,
way
as
before,
preventative
even
measures.
as a preventive measure, sure, because that first 3 months when that spinal column is forming and so forth,
That's
if you're folate deficient, you're
Yeah.
going to have a baby might be deformed spinal column.
6 to 8 weeks?
Surely.
6 to 8 weeks, that's
Surely,
forming.
surely.
Right. And I suggest for the women that want a planned pregnancy, when they go see their doctor and they discuss preconception counseling with their physician, to make sure they leave with a prescription of prenatal vitamins, even if they're not pregnant yet, even if they may
That's
get
right.
pregnant 3 to 6 months down the line, and start taking the vitamins from day one.
That's right, surely.
It has very good health benefits. It's a great preventative,
Surely.
cheap thing to do to
For the
have a
woman?
healthy baby.
And the baby. For
the-
the
yeah.
woman and the baby.
Surely. Because, we forget these kind of things in talking to patients and things like this. So having a program like this to have a Dr. Grover to talk to them, we know it's not over, and that you have to take care of the
Right.
baby and yourself.
Right.
So it's good to have you on the staff here at Downstate Medical Center and
Thank
the
you.
family practice as such, and what you're doing, because it's much easier to talk to women. Talking to women is much more easy sometimes.
I agree.
Because you
Yeah.
think of so many other things that you do that they might do, which a man might not talk about.
Right.
As
right.
easy.
Sometimes it's a little bit more relatable.
Yeah.
When female patients
Well,
talk.
I tell you,
to
because
female-
women are really coming into the medical field heavy at this time. I mean, I don't mean heavy in weight. I'm talking about heavy in information. Because they can sympathize with the woman so much more. Really.
Well, I think that one of the things you brought up was the issue of chips, and I have to talk about that because I love chips. And, they taste good and they're easy to get. And when I'm at work working 14, 15 hours a day, I want to walk to that machine every single day, 3 times a day, and get chips.
Surely.
And one of the things I do, one of the things I tell patients is the bag that many of those chips and these quick snacks are in is probably more nutritious than the snack, the bag, because this is not good for you.
Right.
And you want to do things that are good for you. So that when our women eat fruit, for example, it's good for their skin.
Surely. Oh, yes, yes.
The Coke and the chips are not going to make your skin nice.
I mean,
the fruit will.
Right. We all have cravings. Women especially know this. We all have these crazy cravings. And so once in a while having a bag of chips is okay.
Right, sure.
But make
Don't
sure
tell me that.
But make sure you have your bottle of water right next
Right.
to you to replenish the salt that's in the chips, that it's going to make you dehydrated. But everything in moderation is okay.
Well, Dr. Grover, there's an African American women, argo starch was a big thing during pregnancy, eating argo starch. And argo starch depleted the iron during any time because it chelated the iron in the intestinal tract, and the iron came out with the stool, and so it became iron deficiency, And of course, having a hemoglobin of 6 and 7 and 8 instead of 12 or 14,
Wow.
that's a no-no during
Right.
pregnancy, So I had to fight the whole system of getting rid of argo starch, and it was sold in all stores in community, blue and white box, and they would eat a box a day, as a very severe pica. Yes, and so these are kind of things that you have to look at different races or what they're doing. Different groups of people, they might be eating chalk. A lot of West Indian women would tell me in the West Indies they couldn't keep chalk on the blackboard They would grab the chalk as fast as the teachers would put it out, and they chew on chalk.
Right. It's a
But they have all
cycle.
kinds of things that they chew on, and all that, like you said. What are some? Do you know any of the other things that you have found that some of the women might, beg for in their system, or at least
When they're pregnant, you're
When they're
talking
pregnant,
about? When
yes.
they're pregnant?
In terms of cravings?
cravings? Yes.
Yeah, I mean, you hear about crazy cravings all the time,
Right.
such as, but usually I've noticed it's more salt-laden types of foods rather than not, like pickles and
Right. Yes.
potato chips,
Right, yes.
Just very salty types of foods.
Right.
But each pregnancy is different too. There's so many different types of hormonal fluctuations that are going on and how that interacts with your brain center of
Oh, yes.
cravings and
yeah.
what it wants.
Surely,
And really, so yeah, you just really have to sit down with them. And I think it's important to address. Normally we're like, oh, okay, that's so cute, you have all these great cravings, but you have to get to the root of it. And you have to see if you're right, if there are any type of deficiencies, because it can become a cycle where iron deficiency can lead to other types of, wanting to eat clay or chalk.
Oh, yeah,
and
sure.
then that
That's
just creates a cyclical event.
That's
So it's
right.
very important to address it and not just to dismiss it.
For example,
Well-
children with celiac disease, you know what they eat? Brown garbage bags. And nobody knows why, but they have this craving for fiber. And they
Fiber,
can't
oh,
have fiber.
That's right.
So sometimes the body will look for things that it feels it needs, and during pregnancy, the last thing you want that pregnant lady to have is too much salt,
Right.
because then the pressure goes up and you're worried, or if they're anemic, the baby's not getting oxygen to their brain. Very important.
Well, Dr. Vincent, Dr. Grover, nice having you on the program today with
Thank
all
you.
very important information. And we could continue these conversations again. So you folks out there, I hope you learned a lot today about summertime living and what you should be eating and not eating during pregnancy and things like this. And we hope you'll have a healthy baby. See you next time.